Okay, yes, thank you very much, Pat, and very nice to see you. So obviously known each other for a little while now, and thank you very much, Nesta, for reaching out to me and inviting me to meet you all this evening. So greatly appreciate that, and I'll do my best with this topic. So um, just a little bit about me. So I am an endocrinologist, but actually, probably unlike most of my colleagues around the country, my one of my main interests over the years has been in body weight and obesity and that sort of area. And I've always found, in fact, that these are some of the commonest questions that we get asked. Problems with body weight in the endocrinology clinic. And I have to say, I actually think they're not dealt with very well. So a lot of people express these concerns. And with my other hat on, which is in our weight management clinic, it's interesting. I'd say that the commonest question there, with people I meet for the first time, is whether their weight gain has actually been caused by hormonal disturbances. So I think it's a widespread concern, this, and it's very, very valid. So that's a little bit about me. And anyway, it's great to meet you this evening, and I hope you'll find this interesting. So just going on through this. So we've done the housekeeping. Um, I've got a short presentation of everybody. I'm going to try and keep this kind of informal and non-technical, and I hope that it's helpful. There's a few slightly technical bits on hormones because I think that um, my experience of pituitary foundation meetings is that people like a little bit of the science there. But then we can dwell on issues that may be important to all of you and perhaps come back to them in the chat. So to kick this off, so that question, is it my hormones? I mean, how many times have I been asked that? Well, in a sense, changes in body weight are always your hormones because hormones control our appetite, when we want to eat, if we eat, our food choices, our portion sizes, how fast we eat, when we feel full up. And so, not surprisingly, that is a major driver of body weight and the distribution of fat. So, some of us find that we put on weight around the tummy, for example. All of that's hormonal. So for sure, there are lots of reasons, aren't there, that I think all of us in society tend to struggle with body weight. But actually, you could say that ultimately, all of the influences on this are acting through our hormones. So this is all endocrinology, even though you could say it's not mainstream endocrinology. And I'm going to be very quick about this, and you really don't need to digest these, but I want to contextualize what I'm going to say now, because I mean, clearly hormones are not the only factor driving weight, even though ultimately this is what sort of delivers the weight gain. But I think we all know that over the last 4 to 5 decades, the amount of obesity in the UK, like every other country, has dramatically increased. And that's just a simple representation to kind of show the facts of the matter. And this really says that about a quarter of the adult population, that's with or without endocrine conditions, is now technically classifiable as obese. Now that's not terribly overweight, but anyway, according to the definition, it's about a quarter. And then if you look at overweight, according to the definition, it's actually 2/3 of the population, which is absolutely extraordinary, isn't it? And that's actually happened within the space of a few decades. So that's really the lifestyle that we're all caught up in drives this. So I think remember that just at the start of what I'm going to say. So this slide just says again that almost 3/4 of people in England are overweight. So you see sort of by age group here, there's a large proportion of people who are in the yellow or the purple zone, and those who are at a healthy body weight are unfortunate. It's a minority of us now. I tend to see people with more severe obesity and who come to hospital, of course, and just very briefly, it wouldn't be a big surprise, would it, if this had gone up as well? So really over the last few decades as well, we've ended up with a few percent of the population, let's put it like that, actually having really quite severe obesity. And that's a real shame, because that sort of affects quality of life and isn't great for health either. So that's a big concern for me and my colleagues in our weight management clinic. So, a few percent of the adult population really struggle with this very badly. So, obviously, I'm talking to you at with the Pituitary Foundation this evening. So let's come back to this question: is it my hormones that I just seem to be asked so much? I put an owl at the top left here because this is a kind of slide that you might want to concentrate on, and let's just have a think about. So, I suppose that the traditional areas of endocrinology, and perhaps those that many of you will have experience of, are conditions affecting the pituitary gland, the thyroid gland, the adrenal glands, sometimes the ovaries and the testicles, so reproduction, sometimes the parathyroids that control calcium. So these are some of the important glands in the body. And so the question arises, is it some problem with these glands, or could it be some problem with the hormonal treatments that some of you are receiving? Are you getting too much or not enough? Can that affect body weight? Yes, it can briefly, and I'll come back to deal with this. But I'm just going to go through what I hope you find interesting. It's a few general principles of how body weight is affected and what its implications are, because actually that's the same for all of us, irrespective of whether you've had a pituitary adenoma or some problem with the adrenal glands. It's the same for all of us. So we need to understand this in order to start to help each other and for me to help patients. So I've said that hormones drive body weight regulation. Well, yes, they do. But the other side of the coin here, you can look at this differently. So clearly body weight is partly affected by genetic factors. And we know that because some people in the same family look all the same shape. So we know quite a lot about that. But if you just cast your eyes down that list, and this is incredibly simplistic and short, what I've put up there, but we come to understand that really body weight begins to change very early in life, in infancy, really, and as we become toddlers and go to primary school. So, a lot of early life experience and environment kind of sets things going, if you like. And a lot of weight gain is actually on the way before the teenage years. And then I think in the middle of the list there, I think emotion, stress, and boredom, those are really strong drivers of eating behavior. So many of us will reach for food in those circumstances, sometimes completely unconsciously. But what I'm saying is there are lots of factors affecting body weight, and I can't talk about all of them, but I mean, the last on the list. So wouldn't it be great if our towns and cities had more cycle paths and, were more pleasant places to walk around? So, that affects it as well. So there are lots of issues there. And I always find it interesting to look at newspaper columns and people's comments. I can't believe how many people say that weight gain and obesity are very easily controlled if people are sensible enough to eat a bit less. I mean, it's a very common, somewhat ridiculous point of view, because looking at that list, you can't change your genes, you can't wind back your childhood. You can't change job, you can't change your partner, you can't sort of move out of the place that you live. So all of these factors make it quite difficult, in my opinion, to actually control body weight once it's gone up and become higher than you want. So this is put sort of slightly succinctly. So we're all predisposed. This one says genetics, but it is actually our lifestyle which is the biggest factor here. And I'd say that that's also true if there is an endocrine condition there. The endocrine condition doesn't help, but this is usually also a factor. I don't want to give a medical talk, but there are so many consequences of weight gain that, we seem to be fighting against this the whole time to help people with some of the disease-related things on the left, and then the sort of everyday things that, really affect people and bother them about weight gain. So, there are many consequences of this. I think that, to be fair to my colleagues up and down the country, I think in an endocrinology clinic, none of this gets a look in because, I think that the time ends up by being spent looking at other things. But, this is a serious issue and it deserves serious consideration. Now, technical slide. So I apologize for this and do not read everything on it, but I'll try and summarize it really succinctly. So the balloon at the top, the sort of white and slightly yellowy area, is the bottom of our brains, and the pituitary gland is up there as well, somewhere in the middle. And the point here is that the bit of the brain that's near to the pituitary is also the bit of the brain that controls our appetite, interestingly. And then down at the bottom there, you can see some of our internal organs, our stomach, gastrointestinal tract, pancreas, adipose tissue or fat. And it turns out that there's a sort of system of communication between all of those organs and the brain. That's what controls our eating. That's what controls appetite. So, if you like, our stomach and our intestines get hungry, and they ask us to go and look for food, and they're happy once we eat, and our brains are happier when we eat and we feel rewarded. So, anyway, the point of this is that you won't recognize probably many of the names of the hormones here, and that's because we don't measure them routinely. So, if you go along to your endocrine clinic, you'll have all sorts of conditions that you might have, had amongst you. But, we can measure things like thyroid hormone or growth hormone, but actually we cannot routinely measure all of the hormones that control appetite. So that's been a real difficulty in the field, but I think we're probably going to get better at that. So again, this really just speaks to the fact that appetite is regulated by hormones, but some different ones to the ones that you're used to thinking about. A couple of them are called GLP-1 and GIP. They come from the intestines. And I only put that up because I'll come back to touch upon it. But you see, most people wouldn't have heard of these, but they turn out to be really relevant because these recent drugs like Wegovy, that's semaglutide, or Mounjaro, tirzepatide, actually work on these systems. Now, I'll come back to talk about that because I'm sure that quite a few of you might be interested in that particular form of treatment. So just a few general principles. Look, we're all different, aren't we? And there's nothing that I can say that is going to apply to all of us in that sense, because we're all individual, what our concerns are and how we would approach this. But, a very, very broad brushstroke here is that if we're looking for mild to modest weight loss, say 5 to 10% of body weight, probably achievable for a lot of people with dieting and exercise, but not everybody. But 5 to 10% weight loss is very good for your health. So we know it reduces the risks of things like diabetes and controls blood pressure. So that's great. And, I think many of us feel quite pleased if we can, say, shift a a stone or two of body weight, and it makes us feel a lot better and livelier and often happier. Now, if there are if there's really substantial weight gain and health is more compromised, then clearly we would all be discussing, well, can we achieve greater weight loss? And if you can get to 10 to 20% body weight loss, assuming that you're very heavy in the first place, that is terrific in health terms. It's difficult to understate the health benefits that can realize and the improvements in quality of life. I'll come back to this because actually 10 to 20% body weight loss is very difficult to achieve and maintain on a diet, which has been a real problem. At the bottom there, if you're looking for massive weight loss, which only really applies, I think, for a smaller proportion of people, then bariatric surgery has really been the only thing that really touches that. Now, it doesn't suit everybody, but it's actually quite good for people who need it. I'll mention it very, very briefly. So I think just bear in mind what can be achieved by different approaches. I won't read through this, but dietary weight loss is important, and I think whatever we do, whether it's signing up to the gym or our GP prescribing us a medicine or going along to a weight management clinic, changes in the diet are important, and I think that those of us who are able to get our head around that and stay the course with some sensible changes to the diet, find that is effective. There are lots of simple things that we can do. The main bugbears in life are snacking between meals when we're not hungry, and eating too much, and doing both of those things when we are stressed or bored. And actually, I think I've summed up most of the problems that arise in our weight management clinic. So that's the essence of how we need to help people. But it's difficult to do that because you're really saying that we have to use our willpower to override what our bodies want to do. And that's really difficult because the human body is a tough thing and our hormones are tough. But dietary weight loss, that's really important. Obviously, the tighter you restrict your calories, the more rapidly you lose weight. So the top line there, I mean, the average recommendation is to try and reduce calories by about 500 calories a day. And roughly speaking, you could lose about 0.5 of a kilogram a week. About sort of 1.5 pounds a week. Now, over time, that's really good. So if we can stay the course on that one, say for 6 months, that actually gets quite a lot of people out of trouble to some extent. You can calorie restrict more, but it's a devil of a job to do it because it is really, really difficult, and it makes people incredibly hungry. So we don't do that very much. You just can't keep it up. I mean, occasionally we will do it for very short periods of time, but not usually. There's a lot of education involved in what we do. So this is the weight management clinic, not the endocrine clinic. The endocrine clinic doesn't have time to do this, but many of us perhaps don't always understand the amount of energy or calories that are in food. And I mean, it may well be that many of you are better informed, but it's a lot of people wouldn't understand, say, that double Whopper with cheese meal at the top there is about 2/3 to 3/4 of the entire energy requirement of a normal-sized adult woman and many men. So, if people go out in the evening and eat that, well, that clearly causes a problem. So there's a lot of education around food, and I hope that is readily available to most people. What about physical activity? People often say to me, to Pinkney, I'm on my feet all day. I just cannot seem to lose weight. Well, simple answer to this if you look at the top of the list of activities here, is that if you just sit around watching TV or standing on your feet doing office work, then if you cast your eyes across, it just takes hundreds of hours to lose a kilogram of fat if you're burning up energy at that rate. So actually, to seriously start to change body weight, you'd have to do a lot of the stuff at the bottom of the list, like swimming and fast running. And if the truth be told, that's actually quite difficult for most people to do unless they have a complete permanent change of lifestyle. So um, it's an interesting one, this, but in my book, most people cannot lose weight simply through exercising. Um, and interestingly, the only medical evidence I think that would counter what I've just said is research on people, for example, in drafted into the Thai army and sent on extended hard training for a year or something, then they will lose a lot of weight. But most of us will not lose a lot of weight just by exercising. I mean, it helps to maintain weight, but it really comes down to diet. Okay. What about drugs for weight loss? Because many of you might be interested in this. Historically, we've not really had any decent drugs. I think that's the first thing. And actually, historically, we've had some seriously quite toxic drugs, which have had a lot of side effects and have been pretty undesirable. Um, Going down the list, there are some existing drugs which are not very effective. There's Orlistat, which some of you might have tried. There's some other things which are not licensed, but you can actually get in the private sector, and they're also not particularly effective. But we should spend a bit of time talking about the newer and more effective drugs at the bottom there, and you'll see semaglutide, Wegovy, and tirzepatide, Mounjaro, which have really been in the news, haven't they, over the last 18 months, because these are dramatically more effective than the historical drugs. And just think back to my slide about the hormones that control appetite and body weight. Well, semaglutide and tirzepatide act, if you like, through those systems. So they, in a sense, they're a bit of a golden bullet. At last we got something that really helps address the things that control body weight. So these are the three licensed drugs. What else can I say about this? I think hugely frustratingly, for me personally as a clinician and for many of the people I see every day, there's very limited NHS supply. And I mean, that's not because the NHS is a bad thing. It's just that, it's just that NICE went and approved these without understanding there would be huge demand and there needs to be training of clinics in order to provide people with the treatment option. And undoubtedly, given the demand, which we know is out there, this is going to cost an arm and a leg to the country. So it'd probably sort of make Rachel Reeves sort of turn in her bed, the cost of this if we, had a large number of the adult population put on it. So really tricky. That is about to change. And in June, NHS England at least have said that they want to start making Mounjaro available through primary care prescribing. There's always a catch in these things, isn't there? And the catch is that they want to start this process very slowly, and they will initially be limiting eligibility to people who are deemed at high risk of health problems. Now, it will be possible to be prescribed these medicines, irrespective of whether or not you happen to have an endocrine condition as well. So in principle, for sure, if you've come to really badly struggle with weight, I don't know, because of Cushing's disease or a pituitary problem, you could still be eligible for this. But I think they're going to set quite a high bar on eligibility, which is, I find that disappointing because I think wider access would help a lot more people. Anyway, hopefully over the next year or two, access will improve, and so this will be NHS available. Currently, they are available privately. It's not cheap. I meet quite a lot of people who make the decision that they want to give that a go. And I think there's a couple of 100,000 people in the UK taking these prescriptions privately. And their experiences seem to be pretty good, really, as the research demonstrated. So this is a really good development. What about surgery? It's not up everybody's street, this. A lot of people don't want it, but at least for some of the more overweight people I see who've got to a really high body weight, this is a fair treatment. I mean, it does dramatically improve life expectancy for this particular group of people. It's really safe with keyhole surgery. And I'm a physician, I wouldn't want to be pushing people into the hands of my surgical colleagues. It's the last thing I'd like to do, but actually they are very good at doing this. And I think if people are carefully informed about the pros and cons, I think most of the time it can be a useful treatment. It's got some drawbacks, I suppose. It does affect the ability to eat certain foods, for example, and there is a long-term need to take vitamin and mineral supplements. But in general, it can be a good approach for some people. Coming back to this one, so what do you make of this? Is it my hormones? Well, let's make a few comments about this. So with hypothyroidism, insufficient thyroid hormones, whether that's the pituitary or the thyroid gland, well, yes, that leads to weight gain. And on average, people who are presenting with new hypothyroidism gain weight. Those with overactive thyroid lose it. It's not a massive weight difference, in fairness, and it's probably only, I think it's less than a stone on average. But, I think it shows you that thyroid hormones can affect body weight. So it's always a fair question if you're taking thyroid hormones, whether you're taking enough. And, hopefully an endocrinologist can give you a comment there. Cortisol, well, Cushing's disease or Cushing's syndrome does cause most people to gain weight, and some people pile on a hell of a lot of weight. If it's treated, that is reversed, but it doesn't reverse very quickly, and sometimes not very well. On the other hand, for any of you who have to be treated with hydrocortisone, as sometimes occurs with pituitary deficiency or with Addison's disease, well, too much hydrocortisone makes us gain weight. So for sure, there's a conversation that sometimes has to be had with your endocrinologist. Am I on the right dose of hydrocortisone? I mean, you may well be, but it's a question that you can ask. Growth hormone, so that friend from the pituitary gland. Well, this affects body weight. So if anybody has suffered from growth hormone deficiency, that tends to increase body weight and body fat, which is unpleasant, and it reduces muscle mass as well. So that's not great, is it? Losing muscle and gaining fat. However, growth hormone treatment does reverse that, and it reverses it reasonably well. But again, I think if there's a concern about body weight and other quality of life issues, that's a good question for your endocrinologist. You happy with my growth hormone dose? Estrogen. Well, estrogen, I think, is a big culprit for affecting body weight. In simple terms, estrogen tends to decrease body weight, interestingly. And this is a really complicated topic, this, but I find a lot of women ask me whether as they go into their 50s and 60s, etc., weight gain is due to a loss of estrogen. It probably is partly. So I think that can be a good question to ask. If you happen to be receiving estrogen treatment, is the dose right? I think that's a good question. Similar set of issues, I think, for the men with testosterone. So if, whether it's because of a pituitary problem or a testicular problem, the testosterone level is low, then that tends to be associated with weight gain as well, and a loss of muscle and an increase in fat. So, not a good combination. So once again, if there's concern that testosterone or estrogen are low, that needs to be tested. That needs to be tested. And if you are already taking these treatments, then it's a very fair question. Could it be that the dose is not quite optimal? Could it be improved? So I suppose maybe those are the main hormones that many of us who support the foundation are concerned about. I mean, there are some other ones. For anybody with diabetes mellitus, then insulin often comes into the frame as a hormone of interest because clearly insulin's a treatment for many people with diabetes, but insulin also causes weight gain for various reasons. So too much insulin on board for the treatment of diabetes is not a good thing because it makes us eat more and body weight goes up, and then you need more insulin, we eat more and body weight goes up again. So you get into a vicious cycle. So certainly for people with diabetes, insulin and some of the other diabetes treatments also have an impact on body weight, and there's a discussion to be had there. It's usually in the diabetes clinic whether that can usefully be changed to help bring about a happier body weight. So just really going towards a summary at this point. So is it my hormones? That question that I seem to be asked. Well, yes, I mean, they can significantly affect body weight. I think, but my main caveat to that is that, in the world we live in, I don't think that it's endocrine disease that is the dominant factor, if I can put it like that, in why most of us will gain weight and struggle to lose it. It's a complex one, but it's all of those other things, the world we live in, and the family environment, what we choose to eat and do, lifestyle. That's actually the dominant thing. But for sure, if there's an endocrine condition, it is worth having the conversation. So that's there we go. So I think it is usually possible to get some help here, and I suspect that many of you will have a range of experiences about this. But I mean, my thoughts as an endocrinologist is that I'm quite happy for people to ask me if I can provide them with any advice or assistance about body weight or this question, is it hormonal? And I think that treatment adjustment can help. So so far as I can see, that's a very valid question for the endocrine clinic, and I'd really hope that any reasonable endocrinologist could give you a discussion about that, would listen to what you've got to say, and as necessary, perhaps undertake any tests that might be needed to help you, and certainly advise on any treatment dose adjustments and monitor them. I suppose the obvious thing to say there is that an endocrine clinic is focused on endocrinology, as you all know, and it's these are not weight management services. So if there is a need to take that forward, then it has to be the right channel. So this varies a bit from area to area in the country, we find, but really the doors to knock on here would either be your NHS GP or the local NHS specialist weight management service, which would be a referral point for your GP, or potentially the private sector services, which I think there are some very good ones. Perhaps a main barrier at the moment would be the cost of some of the drug treatments, but this is really where to go to figure out a program of to improve body weight, addressing diet and physical activity and lifestyle. And I think eligibility for drug treatment is actually, that's not very straightforward that at the moment, because we know that NICE, the National Institute for Clinical Excellence, and NHS England, I think it's similar in Scotland, Wales, Northern Ireland, they are going to be limiting access, and so the eligibility criteria are quite complicated. And I mean, my other colleagues in endocrinology will usually ask me, John, what's going on at the moment? Is it possible to get our hands on this or that drug treatment for such and such a patient? So, if you need help from a weight management service, it's a weight management service, isn't it? It's not the endocrine clinic generally. Surgery, well, it's usually via the your GP or the specialist clinic, and it's clearly not a treatment that is applicable or desirable or sought after by a lot of people. But some people are keen on it, and it is a good treatment. And before wrapping this up, actually, the only other thing I will say to you this evening, it's going back to touch on the drug treatment. It's the new drugs are they are actually such an advance. They do open a door to helping people lose more weight, and interestingly, certainly Mounjaro appears to achieve a level of weight loss in quite a lot of people that approaches what you can get with the surgical operation, which is really quite dramatic. So the idea that you could have a safe and reasonably well tolerated injection or tablet that is almost as good or just as good as what required an operation previously is actually quite exciting. I think that's great as a doctor and a researcher. We've actually got to that point. So I think that's exciting. I don't know where we're going at the moment with long-term treatment, because I think the big question that we're asking is, well, do you need to take these drugs for life? Like a blood pressure treatment or whatever, or is it possible to take them for a period of time and then drop them and perhaps maintain the weight loss through just extra vigilance with lifestyle and what we're eating? And I think and that may be possible for some people. I think others might need them on a long-term basis. And so I think there are some challenges there in understanding how to use these treatments. But I'd say that it's become an exciting time, because I think that the treatment options are about to improve, and that's for everybody really, irrespective of whether there's an accompanying endocrine condition. So, with a photograph of Plymouth, the weather's not so nice today down here, but I hope that was of some help anyway. So yes, hormones affect body weight. Yes, endocrine conditions affect body weight. There's a lot of other things that affect body weight, and we have to look at the big picture to try to find a good way forward with this. But I hope that was helpful, and